Hello and welcome to this week's Covid-19 media briefing. It's Friday the 16th of July. This briefing is brought to you by Nottingham City Council and Nottinghamshire County Council to give you an opportunity to get the latest updates on our response to the Covid-19 pandemic. I'm from the City Council's comms team and I'm joined by Abby from the County Council's comms team. On our panel today, we have Lucy Hubbard, Director of Public Health from Nottingham City, and Jonathan Gribbin, Director of Public Health for Nottinghamshire County Council. Usual format applies. Both our panellists will give an update on Covid-19, then we'll open the floor to questions. If you could raise your emoji hand when you want to ask a question, and as always, it's one question and one follow-up question. Please can I ask, can you remain on mute and with your cameras off until it's your turn to ask a question? And for the purpose of this recording, when you ask a question, if you could identify yourself and which media you represent, that would be really helpful. Thank you. So if everyone's happy, I'll hand over first to Lucy Hubbard from Nottingham City Council.
Hi, good morning, everybody. The position in Nottingham City this week is that we've seen 1,464 cases. That's an increase from last week's 1,338 cases. And that means that there is some good news in that we're beginning to see a slowing down of the rate of increase. But we are still seeing cases increasing, and they are forecast to continue increasing over the next few days at the very least. So we're not yet in a position where we can relax and begin to say to people that COVID has ended for us. Quite the opposite. Our case rates currently are 440 per 100,000, which is an increase from last week's 402 and is still significantly higher than the England average of about 380. So the situation in Nottingham is still of increasing case rates, and we're particularly seeing cases now in our school age population. So that suggests that there's quite a lot of COVID circulating in the wider community, because we know that schools are very safe places. So if we're seeing cases increasing there, it's a good indicator that there's quite a lot of COVID circulating in our community. Really important for me to continue to emphasise vaccination. As we're moving to the end of the roadmap, we're beginning to hear more and more about the freedoms that being double vaccinated can offer people. We're also several months into the vaccination programme now and are really beginning to see how successful the vaccine is at reducing deaths and serious illness, but also transmission. We're also seeing how safe the vaccine is. So now that the vaccine is available for everybody aged 18 plus, I would encourage everybody to come forward and have their vaccine if you haven't already done so. Getting a vaccine now is incredibly easy. All of our sites across the city are open 7 days a week, and you can just walk in. You can make an appointment if you would like, and the vaccine is incredibly quick to receive. There aren't long queues, so you can come in your lunchtime, before work, when it's convenient for you. And if you feel more confident, you can come with other people. So you can come and be vaccinated along with your family members or along with your friends. If that is better for you. We're very conscious it's going to be a lovely sunny weekend, and we really want to take the vaccine to where people are going to be gathering. So this weekend, the vaccine bus will be in the Victoria Embankment by the Trent, and will be available on both Saturday and Sunday, 11 till 3. So if you're planning on having a picnic, meeting friends this weekend, please come along to the vaccine bus at the Victoria Embankment and come and have your vaccine. Really important that you have 2 lots of vaccine. The Delta variant has shown us the importance of being double vaccinated, but getting double vaccinated starts with that first vaccination. And I can't emphasise enough the difference that will make, not only to the population of Nottingham City, but also to you personally, as we begin to see some of those greater freedoms with being double vaccinated. From the lifting of restrictions from Monday, there is a change in emphasis from some things being required by law to being recommended in guidance. And we at Nottingham City would encourage our population to continue to remember the asks that we've been saying all along. Wearing a face covering protects people around you. So in line with government guidance, where you are in crowded settings, please wear a face covering. It will protect vulnerable people around you and help keep us all safe. I'm going to carry on with saying my importance of washing your hands as well. That's absolutely critical. And we all know that one of the biggest ways that you can protect yourself from getting COVID is keeping some distance from people. So if you are meeting up with people, particularly in the beautiful sunshine, do so outside where there's lots of space and there's lots of fresh air. Getting tested remains incredibly important. We have lots of ways that you can get a rapid test if you don't have any symptoms. But if you do have symptoms, please get a PCR test and isolate until you get the results. I know that as things are beginning to open up, it's very tempting to think that COVID has passed. But the case rates in Nottingham City say that we still need to be keeping on for a little bit longer. So sticking with those principles of hands, face, space, getting tested regularly and getting vaccinated will make for a better summer for all of us. And that's it from me this week, Steve.
Thank you, Lucy. Can I hand over now to Jonathan Gribben?
Good morning, everyone, and thank you for coming along and participating again this morning. I think by next Monday, across Nottinghamshire, just about everyone will be looking forward to some really positive changes, and many people looking forward to leaving behind them some of the legal restrictions which have been in place over these recent months. But of course, we won't be leaving COVID behind us for the time being. COVID will still be with us, and so many of the measures that we've been talking about these recent months will continue to be relevant to people right across Nottinghamshire, to make sure that we keep ourselves and our families safe and that we protect the NHS from some kind of surge that would displace activity, which it would really rather apply elsewhere. So I'm going to be urging people to act carefully and to remain cautious in all that they do over this weekend and into next week as the legal restrictions are lifted. Let me take a moment or two to tell you about what we see happening across Nottinghamshire at the moment in terms of case rates. Compared to an England average, which now stands at 350 per 100,000, across Nottinghamshire County as a whole, the rate is 413 per 100,000 and has been increasing again over this last week or so. That corresponds to somewhere in the region of about 3,400 people in the last week or so in Nottinghamshire County who have tested positive for coronavirus. We see that increase across the county in general. We see those increases in every district and borough, and in some districts and boroughs we still see increases which are really quite sharp. We continue to see a pattern of cases where people aged under 40 are overrepresented in these cases. So under 40s make up around about 45% of the population, but across Nottinghamshire County as a whole, that group make up about 75%, about 3/4 of the cases that we see. We continue to see a lot of cases in younger adults, particularly in the age group 18 to 22, and also in secondary age children. What we have seen amongst people aged 18 to 22, at least in the south of the county, is some plateauing of the rate in that particular age group. Nevertheless, further north in the county, we see the rate still increasing amongst people aged 18 to 22. And across all of the county, amongst secondary age children, we still see increases in case rates. What we've also observed working with our NHS partners and partners in social care over the last week or so is an increase in activity in our hospitals and in our residential care settings that relates to coronavirus. Now, once again, I should emphasize that this starts off from a relatively low rate. Nevertheless, the activity that we see in our hospitals now does mean that doctors, nurses and other resources aren't able to focus on some of the recovery work which they might otherwise wish to do. So as well as having a serious direct impact on people who find themselves in hospital and dealing with the complications of coronavirus, there is also this indirect impact again. And so it's really important that we continue to act carefully and remain really cautious. Now, in concrete terms, for people in Nottinghamshire, what we need to hang on to as we move into step 4 is that if anyone has symptoms, it remains absolutely critical that you isolate straight away and get a PCR test. For as long as you don't have symptoms, then a really important contribution you can make to keeping yourself and those around you safe is to keep going with twice weekly LFT tests. And of course, I can just remind you that you can find details of how to get hold of those LFT tests free of charge on the City Council and County Council websites and also on .gov.uk. I'd also want to emphasise that as we move into next week, the government, as we're aware, has placed a fresh emphasis on individuals taking informed decisions about what they do. And so I want people right across Nottinghamshire to be really clear that the things that will keep them safe next week are the things which have kept them safe during this last year. It's that frequent hand washing, and particularly when you go into a new building or setting. It's using a face covering, and especially in crowded public spaces. Space is really important still, and that we can think of that both in terms of limiting the number of people who are our close contacts, but also thinking about the way that we mix with other people. And with such fantastic weather coming up, we should take every opportunity to make sure that when we are mixing, we're doing it out of doors and getting some of that fresh air and enjoying that as well as the company of our friends and family. Now, of course, the reason for needing to keep going with much of this is actually highlighted in the government's five-step plan for the summer. And the government has made clear that they retain contingency plans should they be needed. And that could mean, for some areas, measures that would affect localities. Now, in Nottinghamshire, we're going to make sure that that's not the case. But the way that we will do that is by keeping going with all of these arrangements that we've become familiar with over the last several months. Hands, face, space, making sure that we isolate and get tested if we've got symptoms. And if we don't have symptoms, keeping going with the twice weekly LFT testing. And then finally, the one thing that's been such a game changer, which I haven't mentioned and which I must remind people of again, is that if you've received an invitation to come forward for a vaccination, and that applies to any adult now in England, then please take advantage of that opportunity to protect yourself and also to help your community around you. You can do that in a number of ways. You can walk into any of our vaccination centres. You can also book an appointment if you feel that would be better for you. It's really important that if you've had your first dose, that you also follow up at the right time and get your second dose too, because it's that that's going to provide you full protection. So as we move forward into step 4, we're all going to be living how to live safely with COVID-19. And for the time being, that really involves us all in acting carefully and remaining cautious. Thank you.
Thank you, Jonathan. I'll open the floor now to questions. Just pop a hand up if there's a question you'd like to ask. I can see the first question is Joe Locker. Joe, if you just let us know who you are and where you're from, that'd be helpful. And please ask your question.
Hi guys, it's Joe Locker here from the Nottingham Post. Good to see you all again. So our question today is in terms of, I guess, your personal thoughts ahead of Monday. Obviously, it's been widely reported that the UK now has, the highest rates in any European country, and as you've described, they are continuing to increase across Nottingham and Nottinghamshire. So obviously we've got all the clubs, so Prism, Rock City opening from next week. So there's going to be a lot more chances for the virus to spread potentially. So what are your thoughts on the kind of so-called Freedom Day? Cheers.
Thanks, Joe. Who would like to go first with Joe's question?
I'm happy to go first on that one. Joe, thank you for the question. You asked for personal thoughts, so perhaps I can start with a personal one and then work back to something more general in terms of advice and guidance. I think my personal reflection as we move to step 4 would be one that looks back over the last year or so, and a year in which so many people across our communities have been hit so hard, sometimes repeatedly, sometimes with the direct impacts of coronavirus as loved ones around them have fallen ill, and very tragically some of those have died. Others dealing with the indirect impacts and the tremendous burden that many of these restrictions have placed on our households and on our communities. So I think my initial personal thought is one of just remembering that, being thankful and wanting to acknowledge the hard work that people across Nottinghamshire have put in. It extends across all sorts of communities and sectors and parts of our society. And I think particularly just at the moment, with our schools having another 10 days, 2 weeks or so to go, some of them at least, are particularly mindful of the hard work that our school leaders, their staff have put in, our school pupils who've put up with a lot over the last year, and of course their parents as well, who've been bearing with many of the implications of these restrictions. So my personal thoughts are really about, I suppose, looking back and acknowledging and wanting to give thanks really to people who've put in such a lot of work. As I look forward though, into the weeks ahead, my thoughts really are framed in that phrase around acting carefully and remaining cautious. What happens over the next few weeks, as the Chief Medical Officer underlined to us earlier this week, does depend very much on how steadily and slowly we are prepared individually and collectively to take things in terms of that opening up. I am as delighted as anyone else that some of the settings that you mentioned are opening up now, and many other people will be too. But it's really important that we take things steadily, and that means keeping in mind all of the guidance, the hands, face, space, isolating, getting tested if you've got symptoms, getting vaccinated, please, if you've not yet taken up the offer, and even after you've vaccinated, keep going with that twice weekly testing while you don't have symptoms.
Thank you, Jonathan. Lucy, do you have anything to add?
Yeah, I mean, I think Jonathan has put it brilliantly, and thank you for the question, Joe. Our communities have been amazing and have experienced, some really challenging times. We need to remember those challenging times as we move forward into this next phase, and realise just how important these freedoms are. It's worth remembering that COVID isn't just about the impacts of COVID. Is not just about people being admitted to hospital. That's really serious, and what we're incredibly grateful to see the impact that the vaccine has had at reducing those admissions to hospital, that serious illness and those deaths. But there are still people being admitted who are becoming seriously ill, and there are very sadly still deaths. But COVID also impacts on people's lives in many different ways. So we are still seeing high case rates. That means people are still isolating. That means that people aren't able to go to work and bring in, the money that is needed for their families. There is a support available for anybody still having to isolate, but we know that often that's very difficult for families to be able to balance the risk of that. And all of our response across the whole of the pandemic has been this balancing of the risk of harm against the potential benefits. And it's really important. I endorse Jonathan's view entirely. Really important now, after such a tough year, that we begin to open up, that people are able to see loved ones, that we're able to engage again back into those important social contacts. And that's the thing that's been really tough through COVID, is the isolation that it's brought for many people, not being able to see loved ones, to see friends, to live their normal lives. So I also really welcome up the opportunity to do that. But with it comes some responsibilities, and those responsibilities don't just come through to large organisations or businesses, they come through to individuals as well. So we have to remember our role, our responsibilities towards some of the freedoms that we now have. And that is about remembering to wear a face covering if you're in a crowded setting, or if you're in a setting where it would make people feel more confident and comfortable if you're wearing a face covering. So if somebody asks you to, then wear a face covering. Remembering to wash your hands and keep your space. And really importantly, if you have symptoms, no matter how mild, isolate and get a PCR test. Twice weekly testing through the rapid test is really important, and vaccination will make a difference. And they are the things that we can take responsibility for, and have a huge impact on our communities.
Thank you, Lucy, and thanks, Joe. That's a really timely question. Joe, do you have a follow-up question you'd like to ask?
Yeah, thanks, guys. That was great answers. Thanks very much. So I guess the follow-up question is in terms of what's behind, I guess, the continued rise, but also we've noticed in certain areas such as Lenton in the city, typically populated by students. So first, do you think the Euros and the celebrations behind that are behind some of the rises in some areas? But also, do you think the fact students are now going home at the end of term, do you think that's due to the decline in rates in certain areas such as Lenton? Cheers.
Thanks, Joe. Lucy, that seems a very city-specific question at the moment. Do you want to have a go first with that one?
Yeah, thank you. So we are seeing our biggest rate change is the decline in cases in people aged 18 to 22 in the city. And that's really interesting because that does suggest a degree of the impact that socialising has. So I'm not suggesting that people weren't following the guidance, but what we do know is people aged 18 to 22 are more likely to have a better social life than people of my age, for example, and so more likely to mix in groups. So the changing student dynamic has given us some evidence around the socialising impact. And as we're beginning to open nightclubs and we're moving away from highly COVID secure settings within pubs, etc., it does go to show that actually there may be an increase in cases that come from that additional socialising, which is why we are encouraging people to think really carefully about what they do in those situations. We welcome the opportunity for having some fun, for meeting up, but trying to remember that just because you're in a pub or in a nightclub, COVID has not gone away. So we would encourage people to keep on thinking about following the rules, and definitely encourage people to take a test before they're going out, before they're meeting up with people, to know what their COVID status is, so that they can go out and enjoy their night out, relatively confident around whether or not they may or may not have COVID. I haven't seen what I might have expected to see from the football. It's still potentially a little bit early, but actually I think our continuing increase in case rates is demonstrating the wider opening up of our society, and the high transmittability of the Delta variant. We know the vaccine makes a big difference to transmission, so I'm going to come back to the vaccine answer. So the most important thing we're asking our communities to do is to come and get vaccinated. And as I spoke about earlier, we've got a fantastic opportunity this weekend for people to come along to the Victoria Embankment, come and grab an ice cream and grab your jab at the same time if you're over 18. There'll be lots of capacity there, so people will be able to quickly walk through and still enjoy, you know, the beautiful sunshine at the weekend, as well as all our vaccine centres being open.
Thank you, Lucy. Thanks, Joe, for the question. Jonathan, do you just want to check anything to add to that?
No, nothing I can add to that. Thank you.
Wonderful. Thank you. Thanks, Joe. Next hand I can see is Rosanna.
Hi, I just had a question about the vaccine rollout. Just looking at the latest stats, it seems that Nottingham specifically is sort of one of the lowest, has one of the lowest rates in England for when it comes to sort of second doses, which is obviously a bit concerning, kind of going into the lockdown lifting on Monday. I just wondered if you had any thoughts on why that might be, and also if there's any specific groups where you're still seeing that hesitancy in people coming forward, and you know that you're trying to target to get vaccinated.
Thanks, Rosanna. So a question very much about vaccinations this year. Rosanna, can I just check, is it from Gem 106 you're from?
I am, yes, sorry.
Great. So Gem 106 Radio. Lucy, do you want to have a go at that one first?
Yeah, thank you, Rosanna. The vaccine push continues. We are working really closely as a local authority, working really closely with our NHS partners, who sadly couldn't be joining us today, around looking at how do we overcome all of the barriers that might mean that people are not coming forward for their vaccine. And there's a whole range of those barriers, and they vary and change depending on each group. So we know that times make a difference. So we're opening up our centres to really long opening times, 7 days a week. We know that distance makes a difference. So we're looking about how we can take the vaccine out. So over the next few weeks, we have a programme of taking out both pop-ups and the vaccine bus out to our communities. And this weekend at the Victoria Embankment, across Saturday and Sunday, is one example of us taking the vaccine closer to people to make a difference. We know that people struggle to book. Either they find it complicated to book online, or they don't have access to the digital resources to be able to do so. So we have moved to an entirely walk-in offer across all of our sites for all of our vaccines. So we're working really hard to think about all of the ways in which it makes getting a vaccine could be difficult for people and trying to overcome them. We are a young population in Nottingham City. We do have a very large proportion of people who are in the younger age group that have only just become eligible. And we are seeing a more rapid uptake in those younger age groups. But we're not there yet. We've got lots more to vaccinate. I would remind our younger populations that they are still vulnerable to COVID. Some of the admissions that we're seeing into hospital are in younger, unvaccinated people, and so your age it protects you somewhat, but it doesn't protect you completely. The vaccine will really help reduce the risk of serious illness and help protect your family by reducing the risk of transmission. So I would ask anybody who hasn't yet come forward to have a vaccine to do so in the next few weeks. The sooner that we can get large numbers vaccinated, the better. There is no problem with supply. There is no long delays. There's no long queues outside our centres, and they are open for very long hours. So it's just a case of reminding people of the importance of that and letting them know that some of those challenges that perhaps were there a few weeks ago in terms of getting access to vaccine aren't there now. And you know, the bus this weekend at the Vaccine Embankment is a really good example of you know, bringing it closer to the people.
Thank you, Lucy. Rosanna, do you have a follow-up question?
No, that's fab for me. Thank you for that.
Great. Thank you, Rosanna. I can't see any more hands at the moment. My Teams doesn't always play ball with how the way the hands are been. I'm just going to pause for a moment. Does anybody else have a question that they'd like to put to the panel? Do shout up. Oh, Anna Tyler.
Hello, good morning. It's Anna from Capital FM Smooth Radio. This is one that's kind of already been touched on, but I'm trying to make it really specific for our Capital audience. So we're talking 18 to 35-year-olds, so that kind of core audience. With nightclubs opening up from Monday, and we know that they are fully booked, like Ocean is rammed for like 6 nights. Is that a concern? I'm talking specifically about nightclubs.
Thank you, Anna. Who would like to go first?
I'm going to let Jonathan, because I feel like I've done a lot of talking.
Nice one, Lucy. So, yeah, Anna, thank you for the question, which you've asked. You've focused it very specifically on nightclubs, and very deliberately, I'm going to broaden it out. I don't wish to highlight any particular settings in what I'm saying here, but rather come back to the general advice that I gave earlier on. If we're going to move forward into step four in a way that is really safe, then we have to act carefully and remain cautious. If we rush to abandoning any of the measures that we've had in place, or all of these measures, I should say, that we've had in place in these recent months, what we know from the Chief Medical Officer and the modelling that with which the scientists have underpinned the advice he's given is that we can expect to be at greater risk of activity levels in our hospitals, which will add pressure there, which they will be very hard pressed to deal with. So what we're wanting to encourage people to do is to move forward slowly. Now, of course, that means starting to enjoy some of these settings which are opening up for the first time. But as we do that, we want to encourage people to think about how they take advantage of that and how they do it safely. Now, I know that business owners themselves will have a role to play in that, but as customers as well, and as residents, we have a role in exercising our own responsibility in thinking about how we can act carefully and remain cautious. So for as long as people are doing that, I'm not overly concerned. But of course, as we've observed in recent months, from time to time, our attention is drawn to specific events and situations where people haven't exercised that kind of caution. And where we see that, yes, it is a concern, because what we don't want to do is to go into the autumn with rates already at a much higher level than we can really afford to have. We really want to put our NHS and social care system in the best place possible as we move into the winter period. So that requires some action from us all, even now during the summer.
Thank you, Jonathan. Anna, do you have a follow-up question?
Yeah, just another, if that's okay. We've heard today that there are going to be some pop-up vaccination clinics in Primark and some museums and stuff like that. I think it's great that the bus is going to be out of Victoria Embankment. Are there any plans to go to that next level and maybe take the bus to sort of really busy places like Primark in Old Market Square?
Thanks, Anna. Lucy, do you want to have a go at that one? It might be one that we, Anna, it might be more one for our NHS colleagues. I know that they're working on the programme.
Cool.
And there are pop-ups. I know it's to be finalised, but they're looking at mosques and community centres over coming Saturdays. But Lucy, I don't know, I might need to take that one away and direct that more towards NHS colleagues to the exact programme.
Yeah, I mean, I think that sort of operational question sits with our NHS colleagues. What I would say is to reinforce what I was saying earlier, is we really want to and the Victoria Embankment is a good example of taking the vaccine to where we believe that people will most likely be able to access it. And I think there's another example tonight, isn't there, Jonathan, at Trent Bridge, that we'll have vaccination site available at Trent?
So yeah, we just need to be clear about that. That will be primarily available to people attending the match facility, rather than a message that we need to put out to residents more generally. The reason for our caution about the latter is that there will already be pressures around the traffic system around Trent Bridge, and we don't want to exacerbate those and then frustrate residents by having indicated that they can access a vaccination facility that may be very congested. But yes, to the absolutely around what you said around the embankment. And I wonder, Anna, if I might just add something to what Lucy's already covered, because you're right. We're very keen to take the vaccination bus or pop-ups to where people are, and there's good evidence that of how effective that's been. At the same time as that, we are also aware in the county that there are ones and twos of people who won't be able to be out and about, but people whom we've identified still haven't received both doses. So I was involved in some conversations earlier this week about further follow-up, even now that we can do, to try and make sure that that every single individual, but including people who may not be able to get out of their houses in particular, that everyone has received both doses. I think in the county, we're finding that that we're now at a point where we feel that we're doing these last few hard yards, but those hard yards are as important as ever, because every single additional person that we can protect with the vaccine is really precious, and so it's really important that we follow through on that, as well as providing the vaccination facilities where there are lots of people going to be out and about and can access it easily in public.
Thank you, Jonathan. Anna, thank you for the question. Are there any more questions from the media before we wrap up? I don't want to miss anybody. Do speak now if you'd like to put a question to our panel. Okay, if there's no more questions, it just remains me then to thank Lucy and Jonathan, as always, for your time in being here today. Thanks to Abby for supporting this, and thank you to media colleagues for being here today and for your work to keep the public informed about COVID-19. I wish you all a happy Friday and have a lovely sunny weekend. Take care, everyone.
Thank you.
Thanks very much.